Welcome to this explainer. I am so thrilled you're joining me today because, well, we're going to look at your kitchen in a completely new way. We're going to see exactly how your everyday dining table can actually become a literal medicine cabinet, specifically when it comes to treating and managing high blood pressure.
Take a second and just ask yourself this. What if your very next meal was the key to lowering your blood pressure? I want you to mentally evaluate your pantry right now. So often, we're conditioned to believe that getting older simply means accepting high blood pressure as this unavoidable fact of life. But that's simply not true. You don't have to surrender to it, and your very next bite of food could actually be the first step in turning the tide.
Okay, let's dive right into this. Here's our roadmap for today. We'll start with the power of your plate. Unpack the battle of sodium versus potassium, uncover nature's blood pressure medicine, look at the DASH diet blueprint, and finally wrap up with smart swaps and safety.
Section 1. The power of your plate. Food as instructions.
To really understand this, we need to zoom in on the microscopic mechanics inside your blood vessels. You see, the foods we eat, they aren't just fuel to get us through the day. They're actually active biological instructions for our cardiovascular system. Every single bite you take is essentially sending a really powerful message to your blood vessels, telling them to either constrict and increase pressure or relax and let the blood flow smoothly. Once you realize that, you truly can transform your dining table into a medicine cabinet. Let's move to Section 2 and see how this builds. Sodium versus potassium, a balancing act. This is where we look at the key biological push and pull happening inside our bodies every single day. I want you to think of your cardiovascular system kind of like the plumbing in your house. Sodium, which mostly comes from the salt we eat, acts like a blockage. It holds on to water, which adds volume and stress to your plumbing, increasing the tension right up against your vessel walls. But then we have potassium. Potassium is the absolute hero here. It acts as a natural release valve. It actually relaxes those vessel walls and actively helps your body flush that excess sodium right out through your urine. It's just a beautiful balancing act. And to put that into a real-world perspective, take a look at this number, 451 milligrams. That's the amount of potassium you get from eating just one medium banana. The American Heart Association recommends a daily goal of 3,500 to 5,000 milligrams of potassium to help manage blood pressure. So, eating a banana is a fantastic, super delicious step toward hitting that vital daily target.
Moving right along to Section 3, Nature's Blood Pressure Medicine, Superfoods for the Heart.
Now, what's really interesting about this slide is that now that we understand those invisible mechanics of how our blood vessels work, we can look at the specific, scientifically backed superfoods that carry these vital nutrients directly to your heart. Let's start with a really fascinating compound, nitrates. These are natural compounds found in root vegetables, especially beets. When you eat them, your amazing human body actually converts them into a molecule called nitric oxide. And let me tell you, nitric oxide is an absolute game changer for your cardiovascular health. Let me walk you through this exact sequence so you can see just how brilliant the body really is. First, you ingest the beets, absorbing those nitrates. Second, your body works its magic and converts them into nitric oxide. Third, that nitric oxide acts as a powerful vasodilator, meaning it tells your blood vessels to just relax and widen. And finally, step 4, your blood pressure naturally drops. Medical studies actually show that consuming about 250 milliliters of beet juice daily can start lowering your blood pressure in just 3 hours, with the max benefits kicking in at around 60 days of consistent use. But a very quick warning before you go chugging a whole pitcher of beet juice. Here is a pretty fun biological fact to keep in mind. Beet juice might safely turn your urine and feces red or pink, so don't panic if that happens. It's just the natural pigments in the beets making their way through your system. It's totally harmless, but, well, highly memorable if you aren't expecting it. Beyond beets, here are some other incredible superfoods recommended by the National Council on Aging. Unsweetened yogurt brings a triple threat of calcium, potassium, and magnesium. Berries are packed with antioxidant compounds called anthocyanins. Sweet potatoes? They give you an impressive 286 milligrams of potassium in just a half cup. Leafy greens are another massive source of those relaxing nitrates. Fatty fish, like salmon, deliver essential omega-3s, and whole grains like oatmeal contain a special beta-glucan fiber. Each one of these acts as a highly targeted, completely delicious intervention for your vascular system.
Section 4. The DASH diet blueprint, a flexible framework.
So this is where we take all of that fascinating science we just learned and put it into a proven, flexible framework that easily fits right onto your dinner plate. The DASH eating plan, which stands for Dietary Approaches to Stop Hypertension, requires absolutely no special, hard-to-find foods. It's simply a beautifully balanced combination of fruits, vegetables, lean meats, and whole grains. The standard plan is based on a 2,000-calorie-a-day diet, and it's designed specifically to fill you up while naturally lowering your cholesterol and blood pressure.
Here is exactly how to structure those daily meals. You're aiming for 6 to 8 servings of grains, 4 to 5 servings each of vegetables and fruits, 2 to 3 servings of low-fat dairy, and keeping your meats, fish, and poultry to 6 servings or less. Notice how heavily it leans on vegetables, fruits, and grains? This chart really proves you don't need to go out and buy expensive supplements. You just need to follow these simple, structured daily serving targets. And as you follow those servings, keep this vital number in your head: 2,300 milligrams. That is the primary daily maximum sodium target for the standard DASH diet. But for optimal blood pressure lowering results, the plan suggests going even further and aiming for an ideal target of 1,500 milligrams of sodium per day. And finally, Section 5, Smart Swaps and Safety, Practical Reality. Of course, we all live in the real world where habits are hard to break, but hitting that low sodium target is way easier than you might think. You don't have to overhaul everything overnight. Look at these tiny, painless swaps from the National Institutes of Health, and this brilliantly illustrates the concept. Swapping bran flakes for shredded wheat saves you 219 milligrams. Swapping Dijon mustard for regular mustard saves nearly 200 milligrams. Even just choosing unsalted margarine saves you 26 milligrams. These minor adjustments drastically cut your sodium intake without you ever feeling deprived.
And let's talk about the very real challenge of affordability, right? Eating fresh, healthy foods can sometimes seem super expensive, but programs do exist to help. Take 87-year-old Kelly Lightfoot, who shared her story with the National Council on Aging. By utilizing the SNAP program, which provides her with $180 a month in food assistance, she says, "I can purchase foods that support my diabetic diet." It really grounds this nutritional advice in reality, proving that healthy eating can absolutely be accessible, and there are wonderful resources out there to make sure your budget doesn't stand in the way of your health.
So, the crucial point is this. While food absolutely is medicine, you have to treat it with the exact same respect as a prescription. High potassium levels can actually be dangerous if you have kidney disease, because your kidneys might really struggle to filter the excess out of your blood. Also, those magical beets, they contain oxalates, which can increase the risk of kidney stones for certain people. And suddenly increasing your potassium can even interact with specific blood pressure medications. Always consult your doctor before making major dietary changes to ensure your unique body and current medications can handle the shift safely. Which brings us to our final question for this explainer. Now that you know the biological science, the superfoods, and the smart swaps, what are you having for dinner tonight? You've got the blueprint now. Your kitchen is stocked with potential. It's time to put the power of your plate to work. Thank you so much for learning with me today, and I'll catch you on the next one.